I'm Dr. Weiner, and today I'm going to talk to you about questions about filler. It's one of the most common questions I get asked on Real Self, and I'm going to go over the most common questions. The first question is that I have a little or a lot of swelling. Is that normal? It is normal to have swelling after lip filler, and that can occur for up to 2 to 3 days. And the best thing to do for that is to sleep with your head elevated on 2 to 3 pillows. I don't usually recommend ice unless there's bruising, because actually I think that you can get more swelling if you use ice. But that's just my opinion. Other doctors do recommend ice. If there's severe swelling, you obviously need to call your doctor, because there are some problems that could be associated with severe swelling. But most people have some very mild swelling that lasts 2 to 3 days, and it's usually worse in the mornings because when you're sleeping, you don't have the drainage that you do when you're sleeping upright or standing. So that's the number one question I get asked: is this normal? Restylane Silk tends to have a little more swelling than the other fillers, and you should not massage the lips unless your doctor tells you to, because that can cause more swelling. Number two is my lips look a little uneven or lumpy. Is that normal? And actually, in the first day or two, the lips can have a little unevenness or lumpiness to it. So lips aren't always symmetrical with their swelling afterwards. They usually all evens out within 10 days. So I tell my patients, don't really worry for 7 to 10 days about the unevenness or between the two sides, or the upper and the bottom. The lumps do occur occasionally, and those usually go away as well. Occasionally, very minimal massage of those lumps can help. But if the lumps persist for longer than 7 to 10 days, they're probably there to stay, and you need to talk to your doctor about that. Oftentimes, if there is a lump that's persisting, particularly a large one, that can be reduced with a substance called hyaluronidase, which dissolves the filler. And you can do it in very small quantities to hopefully not eliminate all the filler, but just the small little lumps. Another thing is I'm bruised after a filler. Is that okay? Well, bruising after lip filler is more common in the less experienced hands than the more experienced filler injectors, but it can occur with every injector. So what you can do for bruising is apply ice to help prevent further bruising. But in my office, I do a laser procedure the next day and the following day to help the bruise resolve. And that makes the bruising resolve in about 2 days rather than 10 to 14 days if you didn't have the laser. The laser is a free service that I offer. It takes around a minute or two to perform, and it's rather painless. Other things that you could do is take arnica, bromelain, and sometimes, if needed, we actually offer something called Ocumed, which is an arnica patch that you can put around the lips or on the lips that helps relieve the swelling as well as the bruising. What else? My lips aren't or look like they're duck, okay? The problem with duck lips is that they were not properly injected. Now, there's something called the golden ratio, and the golden ratio is 1.6, and that was defined by Leonardo da Vinci back in like the 1400s, and it's still true today. So the golden ratio means that the upper lip should be a ratio of 1 to the bottom lip of 1.6. So oftentimes what I see on Real Self or in public where the lips look abnormal is that the upper lip is either bigger than the lower lip or the same size as the lower lip, and that's not normal. The upper lip should be smaller than the lower lip. So a duck actually has a very large upper bill, and that's why they're called duck lips. So that is a problem that is improper injection, and it needs to be corrected by either putting more filler in the lower lip or reducing the filler in the upper lip. Also, if you have too much curl, too much projection of the upper lip, it could look a little ducky as well. And that also needs to be reduced with hyaluronidase. So people often say, well, what can be done to the corners of my lips? I look sad and frowny. Well, that's not actually a problem with filler, but that's what we can correct with filler too. By putting filler in the corners of the lips, you can turn up those frown, the downturned lips, and make them more even and straight, which is a happier look. So that's about it with the most commonly asked filler questions about lips. The key is not what product you use, and that's another question I get. Is Juvederm better, Restylane Silk better, Voluma? It doesn't really matter what you put in there, although my preference is Restylane Silk. The most important thing is to choose the right injector. When I inject, I use Restylane Silk, and I use a needle. Sometimes I use a cannula. But I inject in a very superficial plane, so the bruising and the swelling is minimal, and the results are fantastic. So don't keep asking what filler I should use. You should research who is doing it. Okay. Another thing is that you should not inject or have injected Sculptra, Bellafill, into the lips, or even Radiesse. Those fillers are a no-no for the lips. People say they want more longevity, but you're going to end up with long-term problems with those. So don't inject those into the lips. That's another question. Silicone is sometimes injected. I don't inject it. There are some long-term complications with that as well. But, and the other question is I get, should I go with implants in the lips? My experience with implants and the experience that I see in my patients is almost all of them do not like the implants, and they're removed. So the long-term solution for lips is usually what I recommend is HA fillers, like I just told you, Juvederm, Restylane, or Voluma, or Lift into the lips. And the more you do it, the more collagen is created, and you get longer intervals in between injections if you continue to do it regularly. And another last question I get asked is how long should lip fillers last? Okay, and lip fillers should last you between 4 and 6 months. Sometimes people, what I recommend is doing one syringe of filler, and then if they say, well, I want it to go bigger, I don't usually inject more than one at a setting, and if they want to go bigger, in 2 to 3 weeks when the swelling is all down, I do it again. And so they get gradually to their larger lips, and not all of a sudden one day small and one day big. To me, that makes it much more obvious, and they have much more swelling and much more downtime when you inject a lot of filler into the lips. So anyways, that's the questions I get asked my real self. Any more questions, look at my website. Thank you, Dr. Steve Weiner, signing off.